This course is Nursing 301 Foundations of Communication and Nursing. It's a 3-credit hour course combined with lecture, discussion, and lab that will consist of simulations and presentations. Instructor information is, of course, my name, my phone number, office hours, and an email to reach me if outside of office hours. Course description talks about the content that will be covered. It's going to be about the foundations of nursing and the profession itself, and how we can use these foundations to advance our nursing career, and both use those foundations again to understand how to ask for help and how we can contribute to the nursing community. Prerequisites for this class are A&P 1 and 2 in pharmacology. The learning outcomes will be identifying concepts of emotional intelligence, becoming comfortable with autonomous thinking, demonstrating the ability to effectively communicate, identifying the foundational concepts in nursing, and verbalizing what it means to have compassion. So some of the assignments or activities, there's a presentation that's going to be completed focused around compassion and key concepts for effective communication. A document that identifies the foundational concepts of nursing and what that history looks like, as well as the concepts behind it, is another assignment. And students will also evaluate peers through feedback with the presentations. Students will use this to develop communication skills and the ability to effectively evaluate in a way that will be beneficial, showing opportunities for improvement. Here I put some of the required materials. There's a publication manual of the APA. There is a communication case study ebook for healthcare professionals. There is a book on the foundations of professional nursing. And last but not least, the book is on nursing communication and its impact on patient safety. All of these are ebooks, so there is nothing that will need to be purchased from the bookstore. Next is the evaluation grading scale, which is the normal grading scale. Course alignment. Here we have the student learning outcomes, which we discussed earlier. Course resources. So for the ability to demonstrate effective communication, the communication case studies book is going to be the resource for that, as well as nursing communication and its impact on patient safety. For this, we're going to do role playing, we'll do some simulations, lecture, and discussion. The assessment is going to be a formative evaluation done while demonstration is happening. The learning outcome of the ability to verbalize what it means to have compassion. The book on foundations of professional nursing and nursing communication and its impact on patient safety are the resources. Again, for this one, there will be some role playing, some simulations mixed with lecture and discussion. Assessment, again, is formative, done while the demonstration is happening or real time. The last student learning outcome is the ability to identify foundational concepts in nursing. This resource will be the Foundations of Professional Nursing text. Teaching methods, again, are role playing, case study or simulation, lecture, and discussion. This is a summative evaluation done by using the collection of work and descriptions of the subject. Next, we have some policies. So we talk about student participation and what to do if they're unable to comply with a deadline. We talk about academic integrity, specifically cheating and plagiarism, with a link to get to the full detailed policy if they want more information. We talk about how we make accommodations for students as needed, and how they can contact and who they can contact to make that happen. We also talk about inclusivity, about we do not discriminate, and we encourage all students to reach out to their academic advisor and their instructor with any concerns. And last but not least, the policy manual link to give the details to these and additional policies for the course and for the university.